wrinkle, wrinkle, call Anita. Reading the poetry contact list from Energy Method. It's reading the contacts from Energy Method contacts.
मोबाइल से करें फोटो सोना में चाहिए आपके पास
प्रेजेंटेशन कौन सा लगता है
वो सर कहाँ है एक बार अपना चला के देखते हैं
પછી આ ચેન્જ કરી નાખવું પડશે અહીંયા. નો નો then we have to move the screen to the from here.
ચાલુ કરો એટલે બંને દેખાશે આ બી દેખાશે તમે આ સાઈડમાં કરો આ સાઈડ રાખો ને તો સ્પીકર બી દેખાશે ને બી દેખાશે નીચે 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 देखाશે
थोड़ा इधर ले लो
बस आ ये थोड़ा सरको नहीं थे ठीक है
उधर ही जाना है
થોડું
बस ना
बस
बस हेलो हेलो
कलर में कलर में बंद
हेलो 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 माइक टेस्टिंग हेलो हेलो
स्क्रीन नहीं दिखेगा.
तो आने के बाद बंद करो ना जो बंद करना है आने के बाद बंद करो सब बैठने के बाद
तो ये बंद करो ये ठीक है.
दोनों आ रहे बस
हेलो 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 हेलो
live on the it's live on the phone. It will be covered the inauguration session.
Yeah. Start right from start.
डायरेक्ट स्क्रीन
अपग्रेड करना है
ओके हां ओके सर चालेल ओके हां हां बस जास्त गेला हां 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 तिथे वेळ लागतो म्हणून सर हां ओके हां स्लाईड आहे त्यांची स्लाईड्स दुसरा कुठला आहे का माहिती नाही ना काय ते हां आता आलं हो कौन सा भी एक लगा
साऊंड लागा आणि टेस्टिंग करेल आपला तो स्पीकर नाही तर ते लावतो I'm also the same. That amplified and we will give you the mic that I cannot stand it. Yes.
हॅलो
जे स्पीकर असेल ते तुम्हाला जॉईन करण्यात खाली आलं की दुसरं जूम અહીંયાથી કરવું પડશે આપણને જે टाइम जिस टाइम पे सर उधर इधर घूमेंगे ना तो हमको जो स्लाइड्स दिखाना है ना वो जूम करके दिखाना है ऐसा सर ने बोला है हाँ अनुप सर ने थोड़ा थोड़ा कम करो थोड़ा ठीक है हाँ बस सर
or right now you change the screen to what you want to change the orientation.
Here, we'll see.
I don't want to have incognito.
पेशंट बघत असतात लागत नाही
लूज
स्टेबल ही रहेगा ना.
गर्मच है ना, चार्जर है. हाँ सर, आता बघा बरोबर आहे ना. ओके. एक
झाले ऑनलाईन जेपी
हाँ सर.
चालू केलं ऑनलाईन.
आता बघा सर.
Good morning, everybody.
चालेल.
I welcome all of you to the 269th birth anniversary celebrations of Master Hahnemann. To begin with, I request all to stand for the institution of the prayer. We'll begin the day with ceremonial lighting of the lamp and garlanding the portraits of Samuel Hahnemann, MAT sir. And today also is the birth anniversary of Dr. Baba Sahib Ambedkar. So I will request Ravi Doctor, we will request Bhavesh Patel sir ji and Manisha madam to please handle the plenary time. I think every occasion always throws up a personality. The occasion that we have selected today is to explore aspects of palliative oncology and homeopathy. As most of you have read very, very recently, that India is fast becoming the cancer capital of the world. We have already achieved the dubious distinction of the diabetes capital, and now we are going towards the cancer capital. In very many ways, I think I have shared with one of the batches that epidemiological transition in nations occur as nations evolve. And a Lancet study, which was done over a period of 20 years or so, indicated very clearly that between 1990 to 2017, communicable diseases gave rise to non-communicable diseases. And that was more from certain parts of the country, especially the south and the northeast, which were relatively better off. They were able to conquer the communicable diseases faster, and the non-communicable diseases started in these countries, states. So now it was just a time period when between the non-communicable diseases we will be able to transit from pulmonary diseases to diseases of destructive origin or cancer. And as we are also aware, and which this particular study has pointed out, that India again carries the distinction of having a female preponderance of cancer as compared to the West, where males are more affected. So this really imposes a heavy burden on our society. And therefore the economic burden, as we all know, is best dealt with through homeopathy. And from that angle, this becomes a very ripe ground or ripe time when we can explore homeopathic application in cancer. Incidentally, our hospital has also decided to take up cancer preventive and treatment as one of the thrusts. And most of you know that we have got CSR funding for organizing preventive cancer camps. We have already been in touch with the Tata Medical Hospital in order to start a chemotherapy center here. And through the good offices that we have, and Kapsesar has been in the forefront, where we have interacted with the Nargis Foundation, and we have a van, preventive cancer van, which is already operating in our community. So looking at all this, we thought that it would be a good idea to have a HAHNEMANN day, looking at what we can do for at least at the level of palliative oncology. So whom to invite? And there was a lot of debate between us. And luckily enough, and unhappily for me, Dr. Ravi contacted me sometime in November, trying to persuade me to come to a palliative oncology conference at Tata Memorial, December, to speak on the subject. I tried hard to wriggle out of it. But I must say that Ravi's persistence and his phenomenal networking has, and something that I saw there when I went there, because long time ago, Tata Memorial used to host homeopathic conferences. And I have myself spoken in one of the Sunavana conferences, which Vishpala had arranged. But then they decided that homeopathy is not good, and so they decided not to allow homeopathy in their premises. So I was very intrigued that Ravi was able to persuade the Tata people to open their doors and to get a host of people, not only from homeopathy, but also from other allied branches, which are responsible and which are instrumental in palliative cancer care, including people from Lucas Clinic from Arlesien in Switzerland. Now, some of you may not know that our relationship with Lucas Clinic dates back, I think, to almost 60 years. When Dr. Kasat sir spent a year or two studying Iscador therapy. And I think some of you may know that the book that he has used is there in our library. I'm not sure whether you have seen it. But it's a phenomenal scholarly book. And it gives in detail all the work that he has done in India, in Mumbai, using Iscador as a ancillary mode of treatment. So we were able to get people from there, and that was largely because Dr. Ravi has been in the field of palliative oncology for the last I think more than 15 years. Dr. Ravi was one of the first and the rare persons who have completed the palliative oncology course from the Tata Memorial. That was way back in 2006. After that, they stopped homeopathy in Delhi. So we are lucky that he is with us. He has also spent a good 4 years in Switzerland studying the various cancer therapies with the Lucas Clinic employees, and I'm sure he has also skied on the slopes of Switzerland. The other thing was that in the palliative oncology conference, we had very beautiful presentations from various people working in this field. And I would particularly remember Dr. Geeta Joshi from Ahmedabad, who runs a palliative course. And it is a really eye-opening course for anyone who really wants to specialize in this field. And I believe that Dr. Geeta Joshi does accept lowly homeopaths. Yes, it does. So I thought that this was a great opportunity for having the Ravi here. Ravi is attached to Saifee Hospital. He got an entry there as a homeopath. But today he is working with Oncology department and he is seeing a large number of cancer cases. Again, the diehards in Saifee would not allow him to use all his skills in the premises, so he has to administer his Ispador outside the premises. But luckily, they don't object to homeopathy. So we are lucky that with his vast experience, Dr. Ravi is here, and he is going to give us an eye-opening talk, incorporating his experiences of palliative oncology. And I would request Dr. Bipin Jain sir to welcome him with flowers. And Ravi, we are giving you 2 good books written by our respected Dr. Tiwari sir and Dr. Manoj on the use of homeopathy as an unprejudiced observer and in the mind. Fortunate that we have the principal of Inaugural College, Masina madam, with us today, and I will request Bipin sir to welcome Masina madam. Our staff, students are very grateful to the Virar College administration because they give us a lot of opportunity for testing our knowledge sharing skills. And I am glad that the interns who are with us are also happy with the type of treatment that they get. With this, I request Dr. Ravi to begin this presentation.
dear friends. So good morning, dear friends. Good morning. Good morning. Today is Sunday, and Sunday is a very special day for all of us. So when there are any invitations, I am very, very hesitant for a Sunday. So yesterday, I tried convincing myself that at least I'll take a later train, but then I get a message from sir, a still earlier train. So for me, waking up on a Sunday morning, it's a big task. But for me, it is very, very special. It is very, very special for a very, a big reason which is very personal to me. The reason being that I always had one dream to come to this beautiful institution once in my life, and that dream has got accomplished today. I mean, it's one institution which is very close, but doing such phenomenal things. That's one of the reasons. The second reason is that when we were in college, sir, हम जब college में थे, तब we used to have two OPDs. One side used to be the CMT OPD and the other side used to be the government OPD. Now, in government OPD, we used to have legendary doctors from Dr. Prakash Vakil, Dr. Vijayakar, and many of them used to be there. And they used to be also our examiners. Few of them used to be from the so-called the ICR community. हमें नहीं पता था ये ICR क्या है. So we used to be very, very scared because ये हमारे examiners बन के आए. And ICR methodology देख के मुझे थोड़ा I used to feel how am I going to pass these exams. और हुआ ऐसे that my wife at that time a student and she was one of the toppers in the in college. She also comes from a homeopathic background. Her parents, her mother actually, they are all Bengal practitioners of homeopathy. In homeopathy, why do we have Bengal? Okay, then we have North Indian, Kerala. We have multiple philosophies running, and that was very challenging for us. So when you come from a particular school of thought, so she had some conflicts with one of the ICR examiners, and in one of the prescriptions when she was a student, she was in the third year, और उसको organon में fail. वो अगर फेल नहीं करते ICR एग्जामिनर तो आज वो मेरी बीवी नहीं बनती. So thank you very much. The ICR community for something which is very, very special. I am sure she is going to be very embarrassed. Finally, she cleared and हमारा roll number आगे पीछे हुआ. Registration भी आगे पीछे हुआ because because her in our time those papers also used to be corrected by internal examiners, and fortunately then she cleared. We cleared from the same batch, and today we are happily married with a wonderful daughter who is also pursuing medicine. So thank you very much, all of you people. You all are doing wonderful, and especially to the newer generation. Homeopathy is going at a different level altogether. मैं मनीषा मैडम, विपिन सर, हम एक जनरा को बिलोंग करते हैं. आप लोग एक अलग जनरा को बिलोंग करते हैं. Yesterday, when we were traveling back from Delhi, so when we went to Delhi, when we saw a mammoth organization out there, I mean, we felt, what is this? Is this a gathering or this is a mass? And that's where the whole world is going to. And that's where Dr. Prajot very well tells me, and he keeps updating me. I don't even sometimes know. I keep asking my daughter, how do you use Instagram? And the first say, Papa, please, yeah, it's don't trouble me. So that's where he says, sir, on a chat box, chat GPT, you put down everything what the patient is saying in the language. Just press, and it gives you rubrics, it gives you medicines, it gives you everything. No need even to repertorize. That's the power and the tool what artificial intelligence is coming into medicine, and your Chandra can actually bridge philosophy, science, technology, all of it to bring homeopathy and to a recognizable level. So thank you so much for a patient hearing, and I am going to present with this topic called Integrative Homeopathy in Palliative Oncology. पहले तो ये जो Palliative Oncology है, इसमें अगर आप लोग परस्यू करना चाहते हो तो एक वेरी इंपॉर्टेंट थिंग, थोड़ा जिगर होना चाहिए, थोड़े गट्स होने चाहिए, ब्रॉड माइंडनेस होना चाहिए, बिकॉज ये जो केसेस व्हाट वी सी, ये हारे हुए लोग, ये साइंस ने कह दिया है कि the science has said nothing can be done, finished, the doors have closed, and when you're working in that environment, that is a huge challenge. So you can imagine where an oncologist or where a surgical oncologist or a medical oncologist, physicians, therapists, everybody has said, boss, I'm sorry, nothing can be done. It's you go home, okay? And that is where we begin. So I'm going to start my presentation with a very beautiful, I will show you some. So this is a small disclaimer. The new students, please, nowadays it's very important to have disclaimers in your slides. Copyrights, permissions, consents, and something very, very important before I also go ahead. There are some photographs. Please हो सके तो social media पे नहीं डालना. These are all copyright images. These are patient images, and it requires a special permission to put this. So क्या है ये palliative care? Very beautiful ना? हम एक flower को देखते हैं. Over a period of time, the flower then starts shrinking, okay? But it's not dead. अभी इसका मैनेजमेंट कौन करता है? जो माली है उसको ही मालूम होता है, okay, how long the flower. We may not know. So it's very important for us to have this knowledge of nature as to how in a human body it's going to discharge. What is the lifespan? How long is going to go about? So this is very important for us to understand. Now, I'll play this very beautiful video. So can you slides to yeah, thank you. That's it. That's it. Dear friends, this is my presentation. Do you have any questions? It's done. Give care to the patient where it's required the most, in whatever you are. Whether you're a homeopath or an allopath or a nursing or a physiotherapist, if you can provide that care, comfort, being in journey what that patient is going through, I think it's all what is required. Today, the World Health Organization is battling a huge, I would say, a burden when it comes to this disease. And if we, as homeopathic fraternity, can give a supporting system, I think that will be the biggest challenge what we will be able to overcome through our pathy. So I think that's my presentation all about. There are a few things which I'm going to talk on personal level. There are a few things which are research oriented. And so please share if there is anything which you feel at any given point of time. Please let me know. We can stop the presentation there and we can of course discuss with you. But everything has to do with this video. Before I proceed ahead, is there anybody in the audience whose parent or relative has undergone cancer and who can share an experience? What was it in their journey? Yes, ma'am. Please, can you come here? It's a learning. If you are sensitive, it's okay. Take your time. Because when you see that, and I also want to tell you this presentation of mine, at any point of time, if you feel uncomfortable, you may please close your eyes or probably put on your earphones. Are completely okay. Because yes, it can become heavy on a Sunday morning. Yes, I don't want to take you to that place, but this is reality. This is life. Sir, please.
My grandmother, she was diagnosed with AML, acute myeloid leukemia. Within a month, she passed. My audible?
So you're audible.
Yeah, so my grandmother, she was diagnosed with AML. Hello. My grandmother was diagnosed with AML, with acute myeloid leukemia back in 1999.
Right.
I was very small at that time, but whatever I recall, I'll tell you. It was a 1 month period. She passed away. She passed away peacefully. And I remember the family discussing about, when they visited the oncologist. He said, if it was my mother, I would have left her alone.
Right.
That's the experience I have of cancer as far as it gets. All I remember, she had lost a lot of weight. She wouldn't eat cancer cachexia, which is classical.
Correct.
So that's the history I have.
How close were you to your grandmother?
Very much. I mean, it is as fresh as it used to be.
Yes.
When we got.
Yes. And seeing her going down, okay, what as a family, I'm sorry,
It's okay, no problem.
what as a family you expected out from the fraternity? From what do you expect? What do you see? क्या ये कर सकते हैं? I can understand
Make it as
medical line of
painless.
treatment was completely gone.
Make it as painless it is possible.
Right.
Okay, and lot, of course, there is a little philosophical aspect to it is that you have to tell the patient that okay, it's okay, but सब ठीक हो जाएगा. I mean, although you know it's not going to get all right, but eventually सब ठीक हो जाएगा. Either way, either with you free yourself from the pain,
Yes.
or the other way around. I mean, you never know, there is a miracle. One in a million time it can happen.
Yes.
Don't lose hope. That's the only question.
Very
So what happens is you are unhappy, and if you are in that state of mind as a doctor, as a family member, patient cannot manage that. I mean, imagine करो वो patient को मालूम पड़ा मेरा सारा family टूट गया है, मेरे को देखिए, तो किधर से patient ठीक होगा?
Very true.
बहुत मुश्किल है. You have to act, you have to put up a face, whatever, do what is needed. You do counseling, you talk to the doctor, involve whomever you need.
Correct.
Because this can give a lifelong scar.
Yes. Absolutely. See, you understand how important it is to have a support system which can support a family. There are caregivers. उनको नहीं पता है कैंसर क्या है, AML क्या है, As a doctor, you may understand, but as a caregiver, that person does not have any idea. That person has never even entered a hospital, never even entered, probably an investigative, kind of a setup. And unko, when they get exposed, it becomes extremely very challenging. Bhavesh bhai, would you like to share some? It's very good. If you can, because I was there in the journey. Yes, so is it okay to share with our doctors?
Sadly, I lost my wife in 2012 to pancreatic cancer, and Sir was the witness for it. The key is I've seen her quality of life going to the level which we could not see, we cannot accept, So that is the key. The key is when it is you are standing against the wall, quality of life should be maintained, and that where the role of palliative and oncology comes into picture.
Thank you. So you can imagine how it is in our own small little room here, how emotions are going. You can imagine how it must be for a family. ये जो phase है ना, ये एक it's like two people in love, आप प्यार में, but आपको पता है वो आगे जाके वो materialize नहीं होने वाला, okay? But इसमें the beauty is there is somebody in the family who comes across and says, बेटा don't worry, मैं तेरे डैडी से बात करूंगा, है ना? और वो क्या करता है? वो hope generate, and that is we as homeopathy. That is where we play a role as a massive support system. So imagine two people deeply in love, they've now become doctors, but the parents are again, but now the girl is probably going to get married, now the boy stopped eating, he stopped sleeping, and many challenges which come. In that there is an aunt or an uncle who is now supporting, and that's what we are, that's what I do. Okay, but yes, as a qualified physician, okay, there are something which I use as therapeutic tools. They are as equal as my stethoscope, they are as equal as my torch, they are as equal as probably a pulse oximeter, because this is something which helps me evaluate. It helps me form a therapeutic model outfit, and that's where I can help my patients. So going up to the next slide is the small historical background. Palghar coined the term palliative care, and you can Google this, and Cecily Saunders, the first St. Christopher's Hospice, which was in 1967 में वो बनाया गया था, and Cooler Ross again, and then came the first. And if you see, okay, if you see this very beautiful place, and that what I see is here, we can create a center like this, where people can come, people can smile, people can have the best part of their lives, people can communicate, and this such an environment where you get back to nature, where there is peace within yourself, and this is something is what is needed in a country like us. We don't require massive hospitals or massive oncology centers for palliative. This will serve as everything. It's a small little shelter, beautiful rooms, comfortable environment, a little garden, enough, and the palliative care center will start running. So, I will first like to go to my first case. Not going into much details, and so this patient was referred to me by Sir knows Dr. Sanjeev Khanna, and so when Khanna sir referred me this case saying that Ravi, will you be able to help this lady? She is diagnosed 4th stage metastatic ovarian cancer with hepatic failure and ulcerative subcutaneous metastasis. You can imagine that on the subcutaneous region, there is a metastasis which has happened, there is an ingrowing tumor, there is ongoing hepatic encephalopathy also, which is there. Bilirubin level is about 12 grams, C125, very high. ELC count again very high. She had fever, poor consciousness level, signs, and a very fulminant necrotic ulcer with discharge, malodor, and most importantly bleeding. Now, imagine a person at your home who's undergoing this, and one of the major things is malodor. How does the family stay? It becomes very, very challenging. In a person where the smell is the main criteria, where they had to actually bandage multiple bandages over her so that the smell does not come out. So you can imagine how distasteful that lady was feeling. She was in this one room and in her bedroom. She had not come out of the room for practically 3 or 4 months. She had not seen her children because she would feel every time the children come inside, they go like this and they go out, and she's feeling completely horrible about it. Imagine where your own body is giving out an odor where the opposite person somehow does not want to come near you. Now this is the photograph. These are the photographs of the same patient, and these are some of the cases that probably you people must have already seen. But why I keep showing this? Because this gives us a direction of how we are supposed to work. This can help us set methodologies. And necrotic ulcer, as you can see, the whole exudate which is there, the mass which is there underlying, there is jaundice. Now, in such cases, what do you do? So, in such cases, what we started is with those remedies. Now, this is how I function. I belong kind of in between a philosophical and a scientific era. Okay, so our birth, which is out there in the 70s and 80s, we belong to this area, and it becomes very, very challenging when you have to bridge yourself, and that's where I'm going to share some very thoughtful insights, what Materia Medica is trying to tell us and how scientifically it can be evaluated. So with the same person, we started with Chelidonium 6 because of course with heavy jaundice. Euphorbium-6 is one of the remedies what we use for pain. अगर आपके पास पेन आता है, यूफोर्बियम, please read about it, please read about the constituents. Euphorbium-6 works wonderful for cancer related pain, and of course with the taking the holistic picture into consideration, arsenic R200 was given along with topical calendula application. Now, fortunately, what started to happen was we were evaluating her on every 15 days, then it went to 30 days and so on. Now 15-day evaluation, the general condition started to stabilize, septicemia had not progressed, WBC count started to settle down. Okay, and one visit with Dr. Sanjeev Khanna, he said that yeah, she's doing good, and most importantly for me there was that the pain started to reduce. Number 2 is the malodor started to come down. Now when the malodor started to come down, automatically we could see that there was a natural course of shedding, debridement, discharge and malodor which was considerably less compared to the previous week. 45th day evaluation, the ulcer size was about 9 into 9, which we felt that the ulcer size had also not progressed, but probably it remained the same, or probably it was few margins less. Now along with this, hemoglobin of course stabilized, WBC count was about 8,000. So overall, what we could see that the patient is stable. Patient has not deteriorated further. Now, a lady who was just given few days of survival. So this is a case which, when I discussed with gynecologists, so we are planning to also get this published case record. So when we saw that there was in general quality of life improvement, that became one of the biggest achievements with regards to homeopathy, and she was not on any. Now all these cases what I'm presenting are only stand-alone homeopathy. There is no other interventions which are given except for maybe some IV fluids and all that. That's it. And so she survived about 4.5 months. But most importantly, what was more important, as you can see, there is these photographs will tell you that this was the first one. Then slowly it started going out. The wound looked more healer, more cleaner. For me, what was very important? For me, most important was that this lady could now come into the hall and sit. This lady could go to drop her children. This lady could be with her family. We know that cancer is spread, it's gone all over, it's not going to kind of cure her, or she's not going to come out of it. But that phase, okay, of 4.5 months, she lived life, and which is very, very, very important in whatever we do, whatever therapeutics we use, whatever line of treatment we do, whether you use constitutional or whether, this should be achieved at the end of the treatment. So this is something what we saw in this lady. So of course, this is with regards to our research people who've been working. So this is probably, so in this case, we have used subcutaneous mistletoe. That means Iscador was used. So it is Iscador, it's viscomalbum. It's already there in our pharmacopoeia. So what basically it does is, it basically stimulates specific and non-specific immune pathways, and it causes selective local cytotoxics. So probably that's one of the reasons which is helped. And of course, calendula along with VA could help granulation tissue. That's why probably the wound look better. But this requires analysis. We are clinicians, and that is why with me, we've roped in somebody like Dr. Palghar, who would probably help us evaluate, put it in analysis, be critical about it, ask us questions, and probably give us a roadmap where such cases can be replicated in multiple people. Now, this is something what we see many times in oral cancers. In oral cancers, this becomes very, very challenging. Fungating wounds, if we can take care, I think it gives a new paradigm to all of us. So, how does an oncologist, so what are the parameters, what we basically see, and how do you evaluate as to how long the patient is going to probably live, or patient is going to die in how long? So we first see is, where is the primary organ affected? This is for all of you students also. Where is the primary? So very important. If the primary is probably in the testes, I don't have to worry. If the primary is probably in the uterus, probably I don't have to worry. But if the primary is in the lung, if the primary is in the liver, okay, if the primary goes in the kidneys, you know what are the challenges which are going to come in the near future. So primary organ becomes the first organ of affection which has to be taken into consideration. Then, once primary is being done, now patient has already taken treatment for the primary, and now there are metastasis in vital organs, again affecting the lungs, the liver, the brain. So you know that yes, these organs are responsible for life. Now when they are going to get compensated, these are the challenges is what I'm going to get. Cancer complications. What are the concurrent or adjuvant treatment? Has the patient taken radiation? Has post-radiation the patient has developed severe side effects? Is the patient on chemotherapy, and chemotherapy is leading to severe side effects? That comorbidities. Is the patient hypertensive? Is the patient diabetic? Is the patient having thyroid? Multiple, most importantly, are the comorbidities. Then very important, along with comorbidity, is there a familial disposition? Multiple people in the family are having cancers. Then comes a general physical health. Going above is the immune status. Then comes the psychological health, and then comes the... This is the pyramid which has to be followed when you are treating a case of cancer, because this is something which will guide you. Now, you can go in any direction. You can imagine a patient who comes to us, and patient tells us that, doctor, I took mummy straight to Haridwar. We went to Rishikesh. We were there for at least a period of 1 month. And she is so much better. Where have we hit? Where is the target? Straight at the top. Everything started to get balanced. Now, it is up to us how, where, when are we supposed to. So usually we get cases which comes up to the vital organs. We get patients who have undergone cancer complications. So there is a pleural effusion, or there is an ascites on which the patients come up to. Now, this is very important, how, when, where we have to, this is what forms treatment and research methodologies. So, how do we analyze this? This is by the EORTCQLC. So there is a score, or most simple is the ECOG WHO score, by which at least you can come to know. It's easy. ECOG is very easy. This is for the oncologist, EORTC QL score, but this is something which can be evaluated. So an evaluation form has to be there on which you can feel how the patient is progressing. Now, what is the future? हम क्या आगे कर सकते हैं? कुछ है जो आगे की सोच कर सकती है. What are the field in which a budding homeopath or a budding research scientist can actually work on? Is there field of work? What is the scope of work? These are the three most advanced stages where you can work if you are willing to work in oncology. The first one, what is cancer? What is cancer? For my lovely junior students, what is cancer? Or for my undergraduate students who are also there. नहीं पता आपको कैंसर पे ग्रोथ होता है, but ये ग्रोथ क्यों होता है? Why? Because of an abnormal genetic mutation. Why? Because there are some genes in us, okay, which start going abnormal, and that is the reason instead of making normal cells, it's making abnormal cells. So the first thing is gene stability. My dear friends, homeopathic medicine, proven, has enough capability of causing gene stability, which also I will show you. This is research. This goes as published. So this is very important. Second comes immune suppression. Patient has taken chemotherapy, patient has undergone a massive surgery, patient has undergone radiotherapy, patient is undergoing immunosuppression, patient is going on steroids, patient with multiple drugs. Immune suppression. हम सबने देखा कोविड में सबसे ज्यादा इंपॉर्टेंट था ये हमारा इम्यून सिस्टम. इम्यून सिस्टम अगर ठीक है हम इसमें से बाहर आ सकते हैं. इम्यून सिस्टम ठीक नहीं है, we are on a losing battle. So you can also lose a person who's probably 25 years of age and the immune system has got abused. A person has an autoimmune and you've given multiple drugs and the immune system has crashed. So immune suppression is a very big area where we require to work. And the number three. Today we talk of psychoneuroendoimmune axis. It was very funny. So when I was in one oncology conference in Bangalore, and so why I have written this? If I just write mind, वो interest नहीं करता है, कुछ नहीं है, mind कुछ काम नहीं करता है. But when I write this, that complexity is understood. So I was in a Bangalore conference. It was an oncology conference. So I was supposed to present a paper, and so there were two oncologists. They were having coffee. So they said that, "और सुनाओ कहाँ से हो?" I said, "Sir, I'm from Bombay." "कौन सा hospital से?" "टाटा से हो?" "नहीं sir, I'm a homeopathic." "अरे हो, तो homeopathic कैसे काम करता है? क्या देते हो आप लोग?" I said, "नहीं sir, I give a nano-pharmacological active medicine made on homeopathic principle." क्या बात कर रहे हैं? I looked at me. Oh, it's a nano medicine. Yes, sir, it's nano medicine which is made through pharmacological principles on homeopathy, and it contains homeopathic ingredients which works at cellular level. Arey research bhejo yaar. Arey good. Come have tea. So same thing presented in a different way because it is not their fault. Okay, the fault is in ours. In our primary education, we talk on mind, but we don't talk on a psycho. So when I saw a laboratory down, I was going to ask sir, I think it's for the first time after years where I see a psycho-neuro laboratory which is there down, and that's what clicks. That's what they understand. We'll have to talk a common language, and this is a very important field where oncology is now fighting its own battle. So this axis, so you may have heard after breast cancer surgery, women are put on anti-hormones, okay? Prostate cancer, again there are anti-hormones, testicular cancer, this thyroid cancer, multiple cancers are to be dealt with this. And trust me, if homeopathy somehow, okay, can target this particular chain, so this is something as a scope what we are supposed to address when we see a cancer patient. So gene stability, immune suppression, and the last most importantly psychoneuro, endo, immune axis, or what is called as, you can Google these words, they are all there. So there is nothing which I've written from outside. None of my slides is from outside. This is all there as published in which you can Google and find out. Now, why would somebody come to us? Why? What is the need? Why would somebody not go to an oncologist and come to us? Is there some data? Is there something which we can show the world that yes, there is evidence-based medicine. There is a need which is coming in society. You can Google this article. It's called Complementary and Alternative Medicine Used in Cancer, a Systemic Review. Now, so as you can see, complementary and alternative medicine is used in cancer is increasing. The purpose of the study was to systematically review the literature to determine demographic profiles. In India, it's so important. We are not Europe. We are not United States. Our culture is different. Our demographics is different. Our financial conditions are different. Socials is different. Now, that is what we were discussing right down. Why in Kerala, homeopathy, why in Bengal and these other places where it is so prevalent. It is prevalent because of these demographic profiles. In allopathic medicine, why was penicillin discovered? Years before that, there was a huge community reach which was going on, and that's where they realized that is a need of the society. Let's work in that way. Hahnemann has given us a directive, but we have to then conceptualize directions to move. Unless and until we do not address demographic requirements, we will still get hit. Let us find out where is osteoarthritis extremely prevalent. We should have an osteoarthritis clinic. I think sir will know that's how NHS functions. We require that kind of an evaluation, a statistician to find out for us. And results showed 51% of cancer patients, these are published results, of frequent reasons for use grouped into themes were shown to influence the cancer and general health and to treat complications of cancer or therapy in general to improve their immune system, symptom control, and most important, improve quality of life and physical and psychological quality of life. Now, this is very important. Unless and until you do not address, so you as a doctor can either take up immune system, you can either take up symptom control, or you can take physical and psychological. It depends on what interests you, where you feel the niche of it, please go into that. Now, these are also published journals, and Dr. Bhatta would be very interested. She must already be knowing about it. So, homeopathy, curative, concurrent, supportive treatment, potential, and Journal of Integrative Oncology. By 2017, there is an article. And dear students, this is an era where you're required to go into the chat GTP. You're supposed to go into research, supposed to find out what a magazine talks about. Go into this literature which gives out absolute what you're looking out for. Feasibility of homeopathic treatment for symptom reduction in an integrative oncology service. And last is review on current status of homeopathy in clinical management of cancer. Now, this is what will set a roadmap for all of us. How are we supposed to move about? We can write to these people. You can write to them. There are emails which are written out here. Let's connect with them. Let's go to them. Let's ask them. You've done a review. Can you help us do? And these are very open people. So let's do this. You all can communicate, you all can write, and I think we can set a completely new platform for developing a cancer center probably anywhere in the country. So this is something which is very important. How homeopathy, it's a conclusion which I would read. Homeopathy can be successfully incorporated within its supportive and integrative oncology service. So this is all the conclusions of the three or four this thing which the research journals. So this is very important. How important your second visit is, how important is your telephonic email service. So this is all which is very, very important whenever we come to a palliative or a supportive therapy in cancer patients. Now, you have to be trained. You can't just go into this disease. No. a policeman, if he has to enter Taj Mahal Hotel, you can't. Those guys are there with AK-47. We should know how to use an AK-47. Only an NSG goes inside. It is different. This, that building there behind, it makes the NSGs. It makes a special class of people. Okay, why? Sometimes we feel they don't even touch the ground because they are NSGs. Trust me, when they go inside, they are ruthless. They know they will get the job done for you. वो ताज के टेररिस्ट को वो लोग निकालेंगे बाहर और ये लोग ही निकाल सकते हैं और कोई नहीं निकाल सकता. You go to J&K, you require an Indian army with a special force going in there. This is where that training happens. That is what. Today when I heard sir that Tata is going to be collaborating, don't miss that opportunity. Le lo. Okay? In the near future, when you are trained by these guys, you will do something in life which is extraordinary. Going into IIT Powai and coming out from there, you are heading somewhere. Okay? So this is where, and my dedication to this lady who trained me, and that is Dr. Luzito, and you can see years back when I presented my first case out there, she held my hand and she took me to the director and saying that he wants to do, and we got a recommendation from Dr. Luzito, can he do, but homeopaths are not allowed, as sir said, then they again close the doors. But we can find a way out. The world is changing. WHO interventions are there. Yes, we can work something out, and that is where we did our conference, which I will show you some photographs, but we require to move in this direction. So my presentation today is not about one single case study, oh it did well. No, it's about the whole picture. This is where we are supposed to go about. These are the people whom we can call. This is the lady whom we can call to our institute. Madam, please give us a lecture. She will be hesitant. We'll have to be persistent enough to get these people so that we can establish something very beautiful for the community. And further on, अब टाटा में काम किया, ruthless patients, some patients are lying here, lying there, and that's where I got an opportunity. एक तो homeopathy किया, फिर टाटा में काम किया, and पूरा mind was going berserk. पता नहीं था, what am I doing, what am I working on, what is, okay, it's like when you want to make some very beautiful dish and the whole kitchen is filled up with all the elements. How do you put all the elements together? How do you prepare the dish? This is the place which gave me a focus where Dr. Kasal had gone, and that gives structure. And somehow, I always feel international education should be availed for homeopathic students in India because it gives you a completely new picture, completely new. आप जर्मनी में बैठ के आयुर्वेदा नहीं सीख सकते. आपको आयुर्वेदा के लिए केरला में आना पड़ेगा, वो हाथ में ऑयल लगाना पड़ेगा, तो ही आपको वो आयुर्वेदा का मतलब समझेगा, नहीं तो नहीं होगा. For which many of them come here, for which we require to go there. ये इनका साइंस है. जर्मनी में ये हुआ है, कैसे देते हैं, कैसे बनाते हैं. So this hospital is called the Clinic Alicine. This is where I got trained. This is where I also work. This is my mentor, Dr. Marion Debus. And as you can see, this boy in this baggy suit, which my daughter hates this photograph. But this is a Lucas clinic. And we run a program where you doctors, where probably we can have exchange student programs, students going from Dr. Dhawale's institute to go, observe, see how it is, come back. And this changed a complete new perspective in mind. Now what is a new perspective? I was amazed to see in pain, you're giving a chamomilla injection. You don't require to give morphine. Patient undergoing chemotherapy and you're giving an arsenic injection as subcutaneous. I mean, what level of pharma is this? I had never seen. Natswamika? What is this? This is something new. And these are pharma products, as you can see. Aconite nepellus, arsenical, formic acid for joint pains, medorhinum. In the wildest of our imagination, medorhinum injections. What is this new thing? We are not aware. India is considered to be the mecca, but this is all under research. This is all under transformation. Maybe after a few years, it will be a big boom to the whole pharma industry. So let us be a small part of it. As you can see, this is hyoscyamus. If you all see very closely, you can also take a photograph of these injections. So Helleborus, Formica rufa, Echinacea comb. So if a patient is undergoing a fulminant ulcer, Echinacea is probably injected all around the margins, and what we see is a direct result of the patient. Now this will be the future which will come out maybe in few years. And other most important thing was that there was this mistlotherapy that they had, very beautiful, and that is when I understood the first time what is quality of life. क्या है ये quality of life? क्या है जिंदगी? Okay, जिंदगी की मायना क्या है? What is the importance of life? Okay, and that is what I could see there, where there was music therapy, there was hypothermia, and sir, in these benches, chemotherapy is given in the garden. For the first time, and Prajot will tell you, there are patients, okay, who are undergoing chemotherapy sitting out there in a garden. It's just a drip which is going in. But how beautiful it is, something which I can never imagine, where the patient is sitting with a cup of coffee, reading a book. You're on a holiday in Hawaii, or you're in a cancer hospital, and I mean, this was unimaginable. Ye kya zindagi hai? Okay, but it can be created in our environment. It can be done. It requires thought process. It requires people with that motivation. It requires people, and this is which can be done. As you can see, we don't like this. We are not salad eaters in our country. We are not, even before food, if somebody gives us kakadi, gajar, I'll go for the main course, but that helps the patient build immune system. This is all structured, and this is very, very important, because this is what I realized. अगर आपको एक सेटअप करना है आपके क्लिनिक में या बाहर, ये आपको लगेगा. This is what I learned. आप single handed नहीं कर सकते. That is why we are just a small part of it. Now you require somebody who can analyze a patient's psychology, so a psychotherapist. Our case taking and the psychotherapist evaluations are very, very different, which I realized. You require a palliative nurse. It's difficult to turn the patient. It's difficult to drape the patient. Difficult to constantly monitor the patient. You require a palliative nurse. You require a nutritionist. Very, very important. You require a physiotherapist. You require, lastly, the most important is a palliative care specialist. There are many. Now, what they have come out is MD Palliative Oncology. There are many of these people who are trained from Tata. Connect with one of them. Severe pain becomes very, very difficult. Hum kya kare? That's where these people can come, and they are very, very open. One person comes here, and which can be done. So, in your clinic, sir, how can I manage in my clinic? It's okay. You can have referrals. If the patient comes to you, there are many physiotherapists around. Contact a physiotherapist. Okay, if there is a nutritionist, which can be done online, but at least you will be able to put a structure to what you can do, and that is called the SOP of palliative oncology, or standard operating procedures. Unless and until we don't follow this, we are going to not get the desired results, and this is exactly what I strictly follow with my patient. नहीं, आपको nutritionist के पास जाना पड़ेगा. आप कुछ भी खा लो नहीं चलता. Okay, you require to undergo. There are some mental traumas, okay, which we see it in multiple patients. एक साइकोथेरेपिस्ट आपको इवैल्यूएशन आपको करके देगा. आपको इतना 3 घंटे बैठ के केस नहीं लेना, वो आपको 1-2 घंटे में सब कुछ दे देगी, which probably you may not be able to evaluate. Very important. So all this helps develop a treatment protocol for our patients. Now, यही तो मारामारी. अब क्या, आगे क्या? ओके, आगे क्या दूं? क्लासिकल भी है, थेराप्यूटिक्स भी है, पैथोलॉजिकल पे दूं, साइंटिफिक पे दूं, पैलिएटिव पे दूं, Kya do, sir? I am confused. So when Prajot got probably, he must have passed out, and and then he was working with me. When he actually goes and sits in the clinic, and when even a patient comes of probably cold, cough, fever, very challenging, very challenging. What do you give a patient? How do you evaluate the symptoms? क्या देना? क्रोसिन भी साथ में दूं? एक काम करता हूँ, मैं डोलो दे देता हूँ, ओके, ताकि रिजल्ट तो आ जाएगा. नहीं नहीं, आप होम्योपैथिक मेडिसिन कंटिन्यू करना, नहीं हो रहा है, ठीक है, तो आप एक काम करिए, एजिथ्रोमाइसिन आप थोड़ा एक डोज लीजिए. And that's how everything starts getting mixed. That's very important because we are not getting, that patient is saying, sir, fever नहीं उतरा है, okay, क्या करूँ? It's sitting on your head. So what are we supposed to do? And when it comes in oncology, a lot of challenges. But that's what we do. Again, focusing on these three elements. The Allen's three-legged stool is what you're supposed to follow. From gene stability to immune suppression. This is what, if you address this, somewhere you will reach. How do I? Now, ये आप लोग की बुक से है, जो सालों पहले मैंने लिया था, और हमेशा ये मेरे स्लाइड्स में रहता है. Okay, most importantly, trust me, no book gives the way a history has to be taken. I understood the value of those complex mathematical or probably physics graph only after I passed out, sir. As an undergraduate student, as soon as I would see those huge circles, it would give me circles. It was difficult, but today I understand how important it is. When you look into it, go by, वो एक अभिमन्यु का चक्रव्यूह है. Go into it, see into it, how, and you can come out of it. It gives you that way. So, very importantly, कैसे करेंगे हम? Now, through case history, disease evaluation, process, treatment response, very important, एक thorough case history होना चाहिए. Completely, कहाँ से चालू हो गया? Maybe I will share a case history sheet what I use in my clinic. Number 2, importance of past history, miasmatic taints, family history, very important. Mother को कभी psoriasis हुआ था, mother को कभी tuberculosis हुआ था. We don't ask that. Mother को कभी urticaria हुआ था, okay, father को हुआ था, cancer था, and so on. Psychological stress factors. What are the stress factors? Okay, which the mother has gone or the father. You are a genetic material coming from there. If that trait is not dysfunctional there, then that's where the disease comes here. So many times when we get, I had this mother who came with a little baby, huge tumor in the eye. I will show you the photograph. And the mother says कि हमारे घर में किसी को कैंसर नहीं था, इसको कैसे हो सकता है? मैंने तो सुना है कि तंबाकू, सिगरेट वो सबसे होता है, इसको कैसे होता है कैंसर? That's a challenge. What does medical science have to answer there? Many times a lady comes and says, doctor, my husband, he drinks, he smokes, he has the most erratic this thing, he's obese, रात को 2-2 बजे सोता है, पिक्चर देखते रहता है, सुबह 10 बजे उठता है, और मुझे ब्रेस्ट कैंसर हुआ. अरे ये मोटे को होना चाहिए कुछ ना कुछ, मुझे क्यों हुआ? That's a question. What do you answer? Okay, now this is an important way you can evaluate. Malignant, most importantly, how do you, what is your whole idea? So malignant disorders develop from grossly abnormal susceptibility, and it's a combination of 4 miasms. Absolutely, starting from carcinoma in situ. I will please Google one research paper which says mathematical model of oncology. How one cell divides and how that whole division. So it may probably take you 12 years or probably 10 to 12 years to develop into a small 1 centimeter tumor. 12 years. But before that, this is something which is very important. How? And that's where HAHNEMANN gave us that whole philosophy. How the tissue starts growing, how the tissue starts forming ulcer, how the spread happens. That's the 4 miasms. And imagine in a patient, the 4 miasms are actually reflecting in one pathology, in one clinical symptom altogether. Now, so what are we supposed to use? So, use pathological journals, that's what we do, or organ remedies, as Punit said. Avoid certain deep acting constitutional remedies. I do, okay. Okay, but I use it after a point of time. Not at that point, but at some point I use it. Avoid high potencies where vital organs are involved, and please, most importantly, avoid injudicious repetition where you feel that no, maybe my remedy will work better, maybe doesn't work. So that's again very, very important. And avoid high potency, as I said, and most importantly, now that's where one thing I wanted to also add in here, please use anti-miasmatic remedy is very important, and that would actually open up the case for you. So, what do I do? This is what I follow. जो science ने कहा, because क्या है, I am in a hospital environment. Okay, I can get challenged at any given point of time. What do I do? Is it if the surgeon is going to ask, or if the medical oncologist is going to ask, कहाँ research में कहाँ दिया है, क्या दिया मेरे patient को? Sir, I have given strontium carb 200 bundles. कैसे करके दिया? Sir, because there is a shiny metal, the patient wears shiny clothes. वो सब नहीं चलता. Okay, exactly. It cannot be done. No, that philosophy doesn't work here. Okay, I remember, I would not like to name, but sir, we were in the OPD, and there was this one patient who had psoriasis, massive psoriasis, gut-age psoriasis. And I was sitting behind this legendary homeopathic guy, and well, she had it in her certain legs, and she was a Catholic patient. She would always like to wear skirts, and I think you all know. Yeah. So sir talked to her for hardly 5 minutes, and sir prescribed lac canine. So I asked, sir, I said, sir, lac canine, why you gave, कुछ symptom तो एक भी नहीं है lac canine का, मैंने तो सुना नहीं है. Okay, so sir looks at me and says, कुत्ता है, goat. Patient is also looking. Arey, she feels like a dog. How did she feel like a dog? It's because the husband doesn't take her out. Husband does not take her with her because she has psoriasis. तो कुत्ते को ही हम वैसे करते हैं ना. That is why lac canine. I said, अरे बाप रे, how this gentleman would have thought and how he is prescribed, and but काम करता है. Because ये जो legends है ना, बच्चों इनमें मत जाना, इनकी ना foresight है. They are like those sharp babas who are there in Himalaya. I'm telling you, they give anything and it works. And I've seen that. It's a cult. It's a cult. Absolutely. You give that one puri and that patient comes next week and says, अरे तो सच्ची गया यार, कैसे किया? We can't replicate that. हम नहीं बन सकते वो. Okay? आप आपकी टेक्निक्स में या तो फिर आप पापा बनो या फिर जो बनो. Anyways, so this is what I follow, and because I have to give with every case whatever has come across, if it's a breast case or so there is mandatory to put the research paper. Now it's become also more mandatory that I have to put it in the file what medicine I am giving, why I am giving, okay, on what evaluation basis I am giving. Yes, some leverage is there, like yes, you can give with your basic homeopathic knowledge, but there should be some scientific evaluation which should be able to tell the physician whether it's not interacting with their drugs, whether it's complementing their drugs, so that they can also give treatment accordingly. Okay, so please go into this. Okay, ये Journal of Integrative Oncology, please, homeopathy, curative, concurrent, supportive, cancer treatment, potential, open access journal है, सब कुछ दिया है. You don't require me, you don't require even any books. ये एक है ना, it is more than sufficient to give everything of all homeopathic drugs are here. Anti-cancer potential of phytologically data. I'm going to talk about this anti-carcinogenic activity of hydroxyl canadensis and so on and so on. Okay, is again very important. And Dr. Vardhan, this is where this is being there. This is what we require to work on. Oral cancer, a big menace in our country, and if that we can help, prevention and supportive treatment, it's going to be the big challenge what we will be able to help conventional medicine overcome. women and men equally. Tobacco chewing, we are not going to leave. आप कितने भी खराब से, we feel pathetic when I see that तंबाकू का पैकेट, अरे क्या बेकार ट्यूमर दिया है यार, okay? But उनको कुछ नहीं फर्क पड़ता, वो खोल के वो खाएगा, वो उसको खोल के देख के स्माइल करके खा रहा है. I have a patient, sir, laryngeal cancer patient. He's been operated, tobacco for the last, smoking for the last maybe 30-40 years, operated by under Dr. Prathamesh Pai. That fellow still smokes. He still smokes. He has a pipe from here. His wife tells me, sir, चुटके से नीचे जाता है, सिगरेट पी के आता है, so धुआं यहाँ से आ रहा है. I said, my goodness, but that's a problem. That's preventive oncology. Okay, and I think Priya, one of our students, also once in a while comes to our clinic, and she's seen it. It's unbelievable. So I think let's all work on this, and if somewhere where we can help, preventive oncology, where we can help reducing the craving through some homeopathic medicines, why not? Why not prepare a tobacco chewing gum and we give it to the patient and say, "Aap ye chew karke dekho." Why not have a tobacco sweet? Maybe we come out with such innovative formulations which can probably help the patient saying, मैं nicotine नहीं खा सकता, but क्या मैं ये तो ठीक है, homeopathic है, मैं ले सकता हूँ, why not? Okay, maybe we can come out with something like that. So now I come to Adisha. हम सबको एक life में एक direction मिलता है. So suppose asking me some questions, and what exactly made you go to this kind of a method? This is where I went. 8-year-old female child, diagnosed of acute myeloid leukemia, her bone marrow hypercellular 70% megablasts, and WBC was hardly 1500, hemoglobin 8 grams. She was in induction therapy of danirubicin, and which she had developed severe side effects. Okay, gastric disturbances tha, neuropathic tha, hemolytic ये था crisis था, and the plan was to shift her on arsenic trioxide. Okay, please Google arsenic trioxide in promyelocytic leukemia. आप जरा Google करना, it's promyelocytic leukemia. Okay, homeopathic evaluation मैंने किया. They had called me. This little girl child, she was so scared when I entered the room. There was fear. She was clinging up to her father. Okay, she wanted the blanket sometime, and the father is telling, "अरे ये तो वो sugar daddy है." Okay, ये मीठी गोली वाले doctor है. He's not this thing. Now that's what we are called. So fair enough, no problem. But but if that can help a child, so the fear, there was restlessness, and what she had burning all over the body, burning in the urethra, burning in the oral cavities. And that's one of the major side effects which danirubicin gives, and that's where when I thought, and so I asked. So that's where arsenic straight potency aati hai 30 as single dose in water every day, which I gave. So how I would usually give for such patients, one single dose which is given in a little bottle of water, glass bottle of water, put it, and then you can take it as sips or as a divided dose which can be taken through the day. So this is something which I had learned under Dr. Banerjee, and now the result what I saw, okay, after few days was very astonishing to me, where her gastrointestinal symptoms, okay, where she was complaining of very loose stools, kuch bhi khati thi, she had to go, her diarrhea kind of settled, nausea also started to settle, she started to eat. Now most importantly, when she would tell me, "Baba, garmi वाटते, Baba, garmi वाटते, जलन सारखं वाटते, Baba काय करा?" She would remove her clothing again, she would put it on, and the parents were, it was mayhem in that house. It's chaos. Little girl, 8-year-old girl, going to school, just about to start a new life, and diagnosed with a disease like this. What do? Challenges aa jata hai. Grandparents are undergoing depression. Everybody's, "Arey, my little child," they're trying to do everything possible. So, reduction of panic attacks became much less, and that whole fear psychosis somehow started to settle down. Blood parameters also settled. WBC count started to rise, and that was very important for me, because otherwise she would keep getting counter infections. In that case, again, how do you give, whether you give an antibiotic or whether you don't, become very, very challenging. And now overall improvement is something which I saw in this child. Now, the oncologist had then decided, okay, to put her on this drug. आर्सेनिक ट्राइऑक्साइड। आर्सेनिक ट्राइऑक्साइड इसी से ही बनता है आर्सेनिक एल्बम। If you go into boring, you open up the boring, and when you read arsenic album, उसके अंदर लिखा है arsenic trioxide। कैसे काम करता है ये? उसका वहां लिखा गया है। Okay, where it's a drug called trisonox। ये क्या करता है? ये P53 को एक्टिवेट करता है सेल साइकिल। ये हमको नहीं समझ में आया, because we are not taught in that particular direction. It becomes difficult for us. Okay, that is why pharmacology is a very important subject. Okay. Homeopathic pharmacology has to be taught in that way, otherwise आप trituration करते रहो और life चलती रहेगी। You have to go into that, you have to go into the molecular way, okay, where as you can see, as trisonox has been used in a treatment, okay, of acute relapsed promyelocytic leukemia, okay, and what it basically does is it stimulates certain proteins, but most importantly P53 upregulation करता है। Those genes which are responsible for faulty multiplication of the cells, okay, ये वो gene को stabilize करता है। It's such, that is how probably question mark our arsenic may be working in our patients. We don't know. We require to find out how arsenic helps gene regulation. Okay, so this is very important. That is where I said, let me research and let me do some observational findings in arsenic in chemotherapy. And this is what we could. So this is about a data of, it's a good volume. It's about 300 patients, which we documented at Saifee Hospital. And what we could see that arsenic, okay, tremendously reduces side effects in students. If you feel, or my dear doctors, if you feel your patient is undergoing chemotherapy, please give a single dose of arsenic, put in water every day in the morning, and I trust you, they will come back and they will bless you and say, doctor, when I sit beside other chemotherapy patients, okay, they are not there, they tell me, मुझे तो side effect होता ही नहीं है. So much so that Sujata Vasani goes ahead and calls up the pharma company and tells the pharma company, which drug have you supplied to me? And this is why I hope this is not a clinical trial. My patient is not developing side effects. And she, whether it's placebo or whether it's a drug, she was confused. Why? Because she's seeing the side effects in other patients. In patients which she was giving, and but those patients were under arsenic treatment, were not developing side effects. They were not. So she thought probably the medical pharma is doing a clinical trial, and this patient which she is registered is getting only placebo. That is the power of this drug. Okay, so please, this can be used, match the symptoms, but usually pathological symptoms आपको आएंगे, pathological generals आपको वही आएंगे. This can be used and it's safe. So this is what we saw. What we saw is reduction of emesis, diarrhea, normalizing of GI functions is what we had seen in post-chemotherapy in about 270 patients, and ECOG score was also good. Most importantly, other which is very, very annoying symptom is the burning, peripheral neuropathy symptoms, where the patient constantly keeps telling, and arsenic I've always been taught, it reduces burning. So this is where it helps patients, and of course then we concluded that why not? We can minimize GI, and at least the patient can eat. There is not much of glossitis, there is not much of aphthe, and this is very important for a patient. So much so that today I can speak with pride that my patient takes chemotherapy under Dr. Suresh Advani in the morning, goes back to our office in the evening, and that is the power of homeopathy. And I presented this in the Vienna Congress, and it was very well appreciated. Even the foreigners did not know. My dear students, again, why I am constantly telling you, क्रिकेट डिस्कवर हुआ इंग्लैंड में, है ना? सबसे ज्यादा क्रिकेट हम खेलते हैं, सबसे ज्यादा सिक्स हम मारते हैं. ओके, सो दैट इज वेयर होम्योपैथी डिस्कवर्ड हुआ जर्मनी में, बट स्टिल इट इज प्रैक्टिस्ड हियर. लेट्स टेक दिस फर्दर, ओके, बिकॉज वी कैन डू इट. ओके, नाउ ये मैं किसी के साथ शेयर नहीं करता हूँ, only on this platform because this is something I'm trying to write a book, and this is where I'm going to be writing. ये बहुत important होता है आपकी homeopathic drug कहाँ काम करती है, okay? Whether it's Condorango, how does it work, where does it work? CS stomach, colon, lung. Now these are published results. Calciracarb क्या करता है? जिस तरीके से arsenic trioxide regulate करता है, Calciracarb is one of the remedy which regulates P53 gene, proved scientific level पे. Okay, Conium, Chelidonium, Hydrastis. Okay, where how does it effective in controlling hormone-independent basal cell breast cancer followed by hormone-dependent breast cancer. So in oral cancers, post-radiation, laryngeal cancers, cervical cancers, and so on. Lycopodium, what it does, how it helps in the liver. Our forefathers, they have given us a direction. Pick up that direction. What were they trying to tell us? Read in between the lines. Right-sided remedy, liver remedy, why it's work. Okay, HAHNEMANN did not have the microscope, but today we have. HAHNEMANN probably did not have these AI tools, but today we have it. They are going to tell us where it works on apoptosis of HeLa cells. So probably if you have a liver cancer patient, probably try using lycopodium in few doses and see how the patient is doing and so on. So phytolacas, sorinum, podophyllum again. Etoposide, there is a chemotherapeutic drug which is very powerful, and if you go into this thing of etoposide, everywhere you will read podophyllum. A molecule is taken, but हम तो podophyllum वो original extracts में use करते हैं. Try करिए, देखिए कैसे benefit होता है. Urothelial cancers, lung cancers, colorectal cancers. Probably, sir, is this the reason why HAHNEMANN or probably the provings tell us about the kind of diarrhea which is exactly seen in colorectal cancers? Probably it's acting at that particular level, okay, where it inhibits DNA telomerase and so on, okay. So taraxacum. Now all allopathic drugs, okay, if you see the source is kind of natural elements which have been there in our pharmacopoeia. So arsenic hai, podophyllum hai, then comes then this one, Taxus brevifolia, Taxol, billion-dollar companies, okay, which make these drugs, anti-cancer drugs, Scrofularian nodosa, Ruta, Symphytum, and last, very important, is Viscum album. Now, Viscum album, of course, sometimes we use it as an injectable form, but you can use it as a low potency, 6 hai, 30 hai, to stimulate the body's immune system, and it's been proved. So this is a very important slide which I wanted to share with you. How does Viscum album work? ये उसका एक mechanism है, maybe I don't want to extend much, but this is how it works, where it causes DNA stabilization, and most importantly in cancer, where we require T and B lymphocyte stimulation. Now, on our parameters to check whether the T and B lymphocytes have got stimulated, and that's what is required. It stimulates, again, very important. So the whole immune system, T and B lymphocyte, granulocytes, macrophages, most importantly the natural killer cells, interleukins, tumor necrotic alpha. These are most important mediators, inflammatory mediators in the body. You're creating an inflammation there, and that's where these plants, okay, are helpful as pharmacological active substance, trying to modulate the whole immune system. And again, I did research on clinical observation and assessment of European extract in quality of life of host-stage cancers, study of Indian cancer patients, where I presented again in Switzerland in 2018. So, these are single case studies. These are not mass studies. Okay, this just tells you how homeopathy works at different levels, how homeopathy can be as supportive care. So, a laryngeal cancer patient है, and 44-year-old squamous cell carcinoma, and patient was non-ambulatory, and malnourishment tha, pain tha, wound extensive discharge tha, which I will just show you. And as you can see, can you see? Just imagine a person who comes to you with such gross pathology. Okay, see the amount of discharge. Okay, it completely alters quality. Psychological and quality of life is completely gone out of the window. When you see this, there is necrosis, there is pain, there is discomfort, there is discharge. Patient could hardly sit up. Now, this is something which is very, very challenging. So please, in such cases, patient is very, very dehydrated. How much of a homeopathic medicine you give, it's not going to work. So IV nutrition is again very important to be given. Antioxidants are to be given. Please put in a Riles tube, because that's where the supportive care comes. Okay. Now, a 3 times systemic cleaning of the wound with saline water, and turmeric and calendula is a very solid combination which you should try. Turmeric, okay, or you get Vico turmeric, which comes, okay. Try mixing Vico turmeric with calendula, and you see magic. Okay, in such cases, this has to be tried. Okay, we also sometimes use ozone cream. I gave high stress. First we started with Q, then we went to 6 and then 13 repetitions, and then of course nitric acid fluid because of this typical bleeding which you can see. This is what is given in Masina Medica. So this is where nitric acid and local, of course, biscamalbum injections which were given. And what we could see is post that the patient's quality of life completely and drastically improved, so much so that he posed for a photograph with me. The person who could hardly stand up stands there, and he told me, please have my photographs in all your presentations. It should be what homeopathy can do. My third case is again a glioblastoma patient. Now, a huge tumor, which I will show you. The patient was bedridden with severe headaches. We wanted to do an online with that patient, but unfortunately, their net there in Kerala is not working. Very young boy, just about final year of engineering, develops seizures, walks on in the classroom, and is scanned for a huge tumor which is there. And this boy had severe headaches. So, in this boy, as you can see, look at the scan. I mean, look at this. It's huge. It's huge. Sir will be able to tell you how massively this is impacting his quality of life. Now, in such a case, what we did was, what I do is any kind of cerebral tumors, I follow Banerjee protocol. Patna Banerjee protocol क्या है? Okay? ये आदमी ने काफी रिसर्च किया है, मल्टीपल पेशेंट्स का किया है और एक प्रोटोकॉल डिवाइस किया है. Okay, and try using the protocol, okay, for some time. So you can use, so Ruta 6, Ferrophos and CP is something which he combines, and Ruta 6 is given in the morning, CP is in the afternoon, and there are 2 biochemic with 1 low potency drug which is given. Now, fortunately, post this Ruta 6, lot of research, you can go and Google it. Ruta 6 के बाद में, what I could do is, okay, his headaches episode reduced. His father told me, Dr. Sahab, इतना headache होता था ना, he would actually go crazy in the house, okay? और tramadol कितना देने का, you know, we all were tired of giving, but this started to help, and most importantly, Levipil of course चालू था, but because probably cerebral inflammation must be going down, okay? Probably necrosis may not be that happening to that level, and the patient started to improve, sleep normalized, he walked with support, and in a 3-monthly follow-up. And most importantly, even the oncologist was very, neuro-oncologist was very surprised, where the tumor size showed marginal reduce in itself in the next scan. No central necrosis and cerebral edema. So this is how you can use certain protocols which are advanced, which requires to be understood. We are at a preliminary level. We start understanding. It's taken me years to understand these protocols and how to put them into practice, and so on. Again, now these are few cases where this is again a relative of our dear trustee here. So again, this lady had come to me. As you can see, the lung, it's completely filled with the fluid on the right side, the pleural effusion, and she was diagnosed by the Tata. Unfortunately, she has a physical disability of poliomyelitis, and she cannot walk. So conventional chemotherapy was not given to her, and we just started with, when she came to me, okay, what we start is Conam 6, because I can report this case then to Tata. So what have you given? We started with Conam 6, a single dose which was given OD, and Calcera Cup 200, because in her there is a gene dependent which is there. She has a very down-regulated P53 gene. So we started with that, and trust me, it's been 2 years since it, but I can show you the report which is there in the previous report. As you can see, is evidence-based medicine. This requires to be researched. Researchers require to work. How does CONAM-6 work? How is it reduced to this thing? Was it just CONAM-6 or there are multiple factors playing onto it? So how is the pleural effusion resolved? This requires to be understood. But as a clinician, my duty is to report. Colon cancer again, multiple failures. So these are a few cases. We also are running short of time. So 6-year evaluation. And so most importantly, how can you summarize? It has to be integrated with other systems of medicine. Inclusive of natural immune modulation alone has a definitive role in palliative cancer management. First. Number 2, a proper training in oncology. You have to become an NSG if you have to enter Taj. Third, combining classical homeopathy with scientific homeopathy, but please maintain cardinal principles of homeopathy. बहुत important होता है. If you feel, sir, there is a sticky discharge of hydrostasis, please, then that requires to be done. That requires to be given. So if there is a patient who comes with severe breast pain, okay, and if she has a lump in the breast, I will go in for phytolacca. I will not go in for CONAM. Why? There is pain, there is tenderness. That's indication, clear indications of phytolacca. And phytolacca also has actions on cancer. That is where we can put our individualistic approach with scientific approach coming together. Quality of life is again very, very important. Proper case evaluation is important. Maintaining proper records is important, including consent. Please take a consent of patients. It's very important. And most important, tell them therapeutic options are available. Otherwise, medico-legal issues बहुत खड़े हो जाते हैं. It should be mentioned. I have advised patient for conventional therapy, including chemotherapy, whatever. Okay? Unless and until you do not tell the patient is always going to be misguided. I know certain homeopathic doctors who can treat stage 4, 5, 6 cancers and say, oh, 1 dose I have given and it's cured. नहीं होता. नहीं होता. It's not possible. Okay? आप लोग जो बताते हो, it is misguiding the world. Taking a photograph, probably putting it on Facebook and then showing the world. Okay? And एक दिन बहुत अच्छा ये हो गया. We were attending one conference and with me was Dr. Rajesh Barve. And the presenter was showing, big shot homeopath, he was showing a wonderful case. And somehow, Rajesh beside me tells me, I think I know about this case. अच्छा, अब ये patient को next slide में मेरे ख्याल से right sided pleural effusion आना चाहिए. Next slide में right sided pleural effusion था. अरे यार, good. This is a cervical cancer and spread to the peritoneum and then to the lungs and then to the bone. Okay, wow. And the next slide showing that that pleural effusion had gone. Okay, and metastasis reducing. And then what he could make out, because the name, and he took a photograph, the last name of the patient was visible. And he said the patient is dead 6 months back. How is this guy showing? I said, to jaake bol, leave it, yeah. I don't want to. But this is what happens. Doctors are doing this for practice. Please don't do this. These are very sensitive cases and they can drag you into a strong medico-legal mistake. So please be very careful and so inform patient about necessary therapeutic options which are available. And this is some slides which you can see. Now, when existence becomes a challenge. So my dear friends, if some of you are not comfortable with these images, you may close your eyes. And this is how pathology comes to us in our clinical establishments. This is how patients present, abnormal presentation, something which you've not seen, something. But if we have a palliative OPD here, or we have it in Virar Medical College, what we are trying to establish, this is where we can help, and such gross pathology which can come, which probably you've not seen. But if you go to those centers out there in Tata, they are used to it. They see it in day-to-day activities. Okay? And this is something. But with such gross pathologies also, I think what's more important is that we can represent ourselves through training programs and presentations, what we do all over the world, and this is where we did the Tata conference, and there you can see our Dhawale sir with the Tata officials there, and that's Dr. Anupama Borkar. Please, let's call her. Listen to her. She's a medical oncologist. She's professor of Goa medical oncology in a medical college there. Let's call her. Let's understand, ma'am, how can we bridge? How can we establish? How can you guide us? Let's take, and these people are extremely very open. Let's call Dr. Ravi Doctor here to our institute to understand how can pain be managed in different aspects. How can a homeopathic doctor manage pain? So this is something, this is the conference what we did in Palghar 2023, and when in the end, this is something which I salute, because this, like they say, no, army mein you get stars. These are my stars, and I have quite a few of them. Yeah, these are the winners of life, and this is our testimonial. This tells us who we are. Each one of them has had a very beautiful journey with me. Each one, many of them probably Prajot also must have seen in our clinics. And when they meet you in somewhere, and then when they smile and when they laugh, I think you have done his justice to many of them. India अभी भी बहुत पीछे है, and that is why I put two photographs. मैंने अपना एक photograph black and white कर दिया. एक photograph मैंने डाला is 1894 में, where you can see the physician examining, and on the right side in 2018, where we see Dr. Prajot there. He was much slimmer at that time, and so there's 2018. We are still here. So we do these rural initiatives. We go to the camps. We go to these areas. As you can see, early free detection cancer screening camp. This is what we do. We take our team, and that's me there seeing patients there. This is what we require to do. This is what we require to go into the communities. And till we don't go there, it's very difficult for them to know what we can offer. And once this is done, now this is a very beautiful musical piece. Can I have the lights off, please? And this is something which you can hear. You can also close your eyes. Okay? This is music therapy. Music therapy is a form of a supportive therapy. But in these hospitals, all these people who are offering this music therapy, they're PhD music. They exactly know what to give. Like we have people, they know which ragas to be given. Similarly, for patients who are undergoing severe psychological stress, the musician plays live music in front of them, and you can see, without any history being asked, silence and just the sound of music, how it's impacting so many neurons up, and the patient is crying. The patient is in a different state, and trust me, as a physician, when you see that, it's mind-blowing. Sir, we had a lady who's not responding to morphine treatment. So I was on the rounds, and the chief oncologist says, I think we should call the heart specialist in the evening. I said, sir, can I witness? She was writhing in pain, ovarian cancer, severe pain, and she was just not being able to withstand the pain. Morphine, how much morphine are to be given? So she said, I don't want to take it, makes me very groggy. The musician came, this lady came in the evening, and when she played, that lady slept like a baby, and which I could see. So, with her permission, and they don't allow you to record, but I recorded it. I said, I want to take something back to India so that let us see. And we are musically very, very cultured. So why not we have music therapy which can make people smile. So please enjoy this. This is something which I would like to play for you, and it's very good. for a long time because there is a very junior homeopathic budding doctors, we have senior doctors. How do we blend everything? And there's a very beautiful word which I always use is let's create an ecosystem of healing. And on Netflix, there is a very beautiful program, David Attenborough. There is a very beautiful in which he shows the whole ecosystem of the whole planet Earth. How important is a lizard? How important is a tiger? How important is a deer? How the whole ecosystem unfolds itself to create something which is natural. So let's all create that, and I think that's what will benefit our patients. Thank you, sir. Any questions? Don't ask tough questions.
Audience, any questions? Yeah.
Is there any program that you are currently running, academic program, where people who are interested can enroll and learn?
Yes, we are currently running. So we finished the 3 batches where we want our students to go to the Lucas Clinic. We want them to stay there for at least 7-day program is something what we plan. And something very important, a good development which has happened is there is a homeopathic cancer hospital in Italy, Dr. Spinelli's. We are trying to do a tie-up with them. Maybe they can also have a lecture for, 3-4 days lectures for us. And so we can have a comprehensive training program where a student or anyone can have a complete idea of what is happening in the outside world. So we are into it. We are restructuring the program, and that is what is currently in the process. So till last year we were conducting it, but we are putting it, restructuring, getting a lot of homeopathy into it, and different faculty also we are trying to increase. This is what is the current program. As soon as it gets done, I think you all will be the first one where we can share.
I have an experience to share about cancer clinic.
Please, please, sir.
Come on.
Please, so that we all. There's a wire here.
Yeah, I don't have too much of experience, but I had one experience which gave me sleepless nights, and like this going to be like I might want to also ask you questions about it. Like you said that there are some protocols, and that other part of NSG, it is actually like NSG because you give a remedy, patient is in so much pain, you give 3 doses, it doesn't work, open the materia medica, open the repertory, give the second remedy, make sure the patient sleeps. It's like literally like how you encounter terrorists. It has been like that. So also, I mean, as far as not take me wrong the other way, but as much as we can romanticize the treatment of cancer, it is mayhem when it comes to treating one-to-one. Your referencing is on the spot. Your referencing is in your sleep. You have to live that treatment, and there is no other way to. And then you have to face defeats, you have to face. So, reason I'm saying this is because what happens in homeopathy conferences is everything gets romanticized, all good things showed, but when you live that.
So that's what, in many of my cases where you could see where I actually some patient has lived for 4 months and then died. Okay, so this is a progress which basically happens. So we should know our scope and our limitation, and so that pyramid exactly will tell you. But these success stories are something which we can learn. Failures also we should learn. But this is something which gives me one direction. Oh, maybe this is where I was faltering. Maybe in that patient where I have been able to achieve a success, probably let me use certain protocols trying to help it. And that's where, so if I say, for example, if I'm seeing 10 cancer cases, probably 4 would be in success, 6 are the failures. But those 4 become very important for me to take me further. That's how. And for example, in pain, so again, there we require to evaluate whether there is any nerve root involvement, whether there is any organ which has been pressing, whether the cancer is actually eroding into the nerve, this thing bundles out there. So different types of the pain management. Okay, it's a complete different thing. But something which I would like to share with you, in case you get a patient with that severe pain, where morphine is not available, my dear friends. Nowadays, you all must have heard something which is called as a hemp oil, cannabis oil. Cannabis abhi has become regularized through Indian government as an FSI product. Okay, little bit of cannabis, if it is applied locally, patient will be benefited at least about 60%, and then rest tramadol or any painkiller is going. But that relief where the patient say, doctor, मैं पहले 3 tramadol लेता था, अब मैं सिर्फ 1 लेता हूँ, वो आपके oil लगाने से मेरा काम चल रहा है. So this is something which we learn with experience. You know, these are specialized things in oncology. Pain management is one very. Still not, then yes, you require to undergo a nerve block, which is done in Hinduja Hospital. You can write it. It's a pain management clinic, okay, where there are specialists for that. So in case there is this kind of. So I had a case of a trigeminal tumor. Imagine, okay, the parotid lesion had then invaded into the trigeminal nerve. Ouch, that's painful. That can become. Now, one day, when the patient, that lady, when she came for a follow-up, I saw some marks on her face. I said, what are these marks? Hey, marks kya, why? The husband says, सर वो ट्रामेडोल का इफेक्ट ना रात को खत्म हो जाता है और डॉक्टर ने बोला है कि 3 ट्रामेडोल तो दे रहे हैं, अभी ज्यादा नहीं दे सकते. So they tie a cloth so that she can scream. My goodness, how can you scream? So she said, वो पहले चिल्ला रही थी ना, बिल्डिंग में सब लोग डर जाते थे. But I said, then that's foolishness. Please go to Hinduja Hospital. They will immediately inject, or probably they will cut out only thing. एक side का face droop होएगा, but that's okay. But pain can be managed. So please involve people. Please involve those experts. Otherwise, then that lady got immediate relief. She went there. They did a surgical intervention. They removed out with this thing. The tumor is going to be there. But of course, the sensory functioning of the nerve will complete. But that's okay. You can live with the pain. So that's very important. But cannabis, which is available, and I can also share the number. Please contact that fellow. You can get the oil which can be applied and it gives good relief. Only thing, when applying, wash your hands, otherwise you will be hallucinating. Yes. Yes, sir.
One question about, you mentioned about 4-miasm.
Yes.
An anti-miasmatic drug.
Yes.
Experience at the palliative stage, number
Yes.
one.
Yes.
Number two, any homeopathic aggravation which is talked about.
Yes.
Because these are the two things which we face in practice.
Yes.
When we are slightly ambitious more.
Absolutely. So, sir, giving an anti-miasmatic especially, so one of the most safest anti-miasmatics is what I have seen is Thuja and Calendula. I was surprised to see that in Calendula it is written that it can be used as anti-miasmatic in cancer, in palliative stages of cancer. Yes, I was also surprised. But in any case, carcinosin is something I don't give initial stages because I could see deaths happening because of carcinosin. Probably, I don't know, but it is one drug. Till you do not have a genetic stability of the disease, do not give such a strong, deep-acting drug. That can be evaluated clinically or radiologically or through investigation, where the patient comes across and says, doctor, I am much better, I am eating well, my sleep is also fine, my normal parameters are fine, I could not walk, ab main chal rahi hu. Observe that patient probably, but there is a strong family history of cancer and we require to give her carcinosin, but give her only when her homeostasis has stabilized. If not, it's going to work in a different direction. Yeah. Wow. Please, all of you students, evaluate the patient. Hemoglobin बढ़ रहा है, great. Radiology, stable. फ्लोरल एफिशिएंसी बढ़ानी है, पेशेंट चलने लग गया है, खाना खा रहा है, रोटी खा रहा है, सब्जी खा रहा है, सो रहा है, मूविंग, साइकोलॉजिकल स्ट्रेस कम है, फिर आपको जो करना है आप करिए, वो लेवल तक लेके आए, जेनेटिक स्टेबिलिटी लेके आए. ओके?
Very important point that you have raised here. How do we differentiate whether to go for a palliative management
जी.
or a more aggressive management?
जी.
Because even I am seeing that the allopathically also, given advances,
जी.
the curability of cancer is changing.
Yes.
Compared to what it was 25 years back.
Correct, sir.
So as a homeopath, how do we distinguish between a palliative approach and a more deep acting approach?
Right.
And what are the indications?
So the basic definition of palliation is physical and psychological care which can be seen at any stage of the disease. It can be seen in stage 2, stage 3, stage 4 at any given point of time. And whether even if the patient is undergoing chemotherapy, that's why the whole definition is changing to WHO. Palliative care starts from the day the cancer has got detected. Because that's from where you are now taking care of the patient. With regards with aggressive, so there are certain parameters. If the treatment has failed, whether there is a recurrence, which is to the vital organs, there is a lack of financial this thing with the patient. All those parameters explain to the patient, then only we can start with homeopathic palliative line of treatment. If not, if I feel that if there is a lady who's come to me with a breast lump, which has gone into there is axillary nodal metastasis, but she can still be cured, she can still be taken care of, even if it's a necrotic mass. Let me tell you, there are conventional lines of treatment which can regress the state. So it again depends, but yeah, the same breast has gone to lymph nodes, gone to the spine, lung, brain, then we know nothing can help. So it again depends on our clinical evaluation, how extensive the disease is. Otherwise, yes, please tell them to follow conventional line. If they still don't want to, there is something which modern oncology has come across now is oral chemotherapy. You know, which is the new this thing, and there is something also which is coming on TED Talk. I heard about re-engineering your lymphocytes and putting it back, which they say it can cure cancer. Now we don't know how far this is going to work, but in case if the patient doesn't want to, then at least some supportive conventional line can be given so that together we can prolong the quality of life.
Last question.
Please, sir.
A lot of things are being discussed about the same medicine, potent type, allopathic medicine,
Right.
chemotherapy.
Correct.
And back. Any of the experience?
No, sir. Because that's a completely different. I've never used it.
Because there is a lot of thing happening in even Bengal school.
Correct.
Where they have done potentization of the same ingredient.
Correct.
And then they find less side effect of that. Which you have talked about that arsenic case.
Very true. Very true. Very true.
So like that arsenic experience, any of new ingredients which is coming in the market, if it is potentized into homeopathy.
So again I come back that this also has to be proved. Okay, so if there is cisplatin 30 or amoxicillin 30, it has to have that proving. This is Conam which has been proved by HAHNEMANN method, put into our pharmacopoeia, and we are trying to explore into deep. This, we are taking somebody else's molecule, and arsenic has already been, and probably they would have taken arsenic from our pharmacopoeia, which happened to me. Which if there is time of 5 minutes, if I can just say one small incident, which I talked at Tata and which I always talk. When I was presenting at Tata, what happened was I was presenting a few clinical cases where we've been able to help with arsenic, and so it was their conference where I was just invited. And when during presentation, what happened was one of the oncologists, he got up and he says, this is all quackery. Nothing of this works. Okay, do you have any published results which can tell us? One more oncologist got up. She also questioned me. 2-3 of them. Now in the front row, okay, so the honoraries, or probably the head physicians, all of them sit in the front row. So they all were sitting. So one of them got up, he looked back and he says, which department you're from? He says, so you're questioning me? Yeah, which department you're from? I'm from the gynec and obs department. You? I'm from head and neck. You? I'm from hematological. They're all questioning me like, they were going to throw me out only. I felt like that. Anyways, so sir questions. Saying, do you know about wind Christine and wind blasting? Was a question asked to them. Saying, of course sir, we know about it. We use it as chemotherapy. Do you know about podophylotoxin? Yes sir, of course. They started this thing. These homeopathic doctors, they have been using this since 17th century. It's there in their pharmacopoeia before your multi-billion-dollar company put it across to us. Wind Christine and wind Blastin is made from a beautiful flower called Vinca minora, which these guys have been using. इनसे सीखो, आगे क्या करना? was standing and he looks at me and he says, son, be ready for criticism. But please follow the path because your founder has given you a beautiful word called Ode Sacred. Use it. And all these guys, they came and met me later on, and that oncologist was questioning me, comes and tells me, doctor, my grandmother is having severe pain. Can you give something? That's where we are. Yeah.
So that was a beautiful presentation. I think it's very, very, very educative. When I look at the whole presentation, I was really attracted to your pyramid. And that pyramid actually explains the whole concept of homeopathy and homeopathic management of oncology. Because I was just wondering that we are dealing it at the 3 level of drugs. When I saw multiple drugs going on, and I was just thinking that what is it and how it can be worked upon. So that pyramid talks about the spiritual part above and the structural part below. So where are we looking at from the management perspective? Are we giving a remedy which covers from spiritual to structural part? Are we giving remedy which covers the structural simillimum, a functional simillimum, or the simillimum which covers the whole pyramid? And that all probably guide us to the management, what remedy, when to give, and whether we can give 3 remedies or 4 remedies which are covering different levels of similarity just to reduce the pain, the suffering, and not wait for the complete simillimum to work or inducing a killer's aggravation. That was a second thought. Probably I thought that conceptually whether we are able to connect it to it. Because the next slide, which had talked about immunosuppressants and psychoneuroendocrine axis, which Dhawale sir has talked in his book long back, and where the whole of our SCR system works. And the whole system, the psychosomatic medicine by itself. So that was an integration, that how you look at the cause. The cause, if we are able to detect cause at a psychological level, spiritual level, or we are able to detect nothing but just a symptomatic presentation. So are we able to deal these cases? That was a great question which strike me, and after seeing your cases now I have started thinking in a different perspective of managing oncology patient. Second interesting part was arsenic. I recently had an experience with my cousin who has got a poorly differentiated squamous cell carcinoma of esophagus. He must be around 1.5 years older to me. And post chemo, he started complaining. Extreme weakness, all classical arsenic symptoms. So I immediately started arsenic. Within a couple of days, everything disappeared. The whole chemo symptoms have disappeared. And then I told him, if you are under chemo, just continue HS doses. Single arsenic. He has gone through his chemo very successfully without further side effects. Gone through radiations with no impact. Probably now he is there in Mumbai for the... So then I will think about the defect. Third thing which struck me, which is very, very interesting, you talked about calendula. You look at ruta, you look at symphytum. When you even read arnica, with the type of acid which has, they all have got anti-cancer properties. So are these drugs of injury group, are we able to explore and understand them and their application? Because in a lot of those drugs which are belonging to the same age. Yes, so that is also there in your study. Yes. So that is something which is all of us to explore. Now these are all questions which have come out of this presentation. And last thing about carcinosin, I mean, I must share, I had 3 cases. One, probably we have almost cured with carcinosin as a constitutional remedy with a very infrequent dose. There were 2 other cases. One was CA breast, which was in a later stage, but then they with chemo and it was okay. I gave carcinosin as a constitutional level, and the lady lived for some time and passed away peacefully. And third case was CA lung with ankylosing. So CA lung, the guy got operated, and then he was on some drugs and some side effects. Initially, I had given natrium for ankylosing before even he developed CA. After CA, he came back to me. I re-evaluated the whole case, and I realized I have mixed carcinosin. And after that carcinosin, the CA symptoms or nothing has relapsed, and his ankylosing has improved, the mobility has gone, and even the spine has lessened. So, another lesson which I have learned out of your that pyramid, that if you are able to match even the drug like carcinos from above to below, and if you are prescribing with the caution, it is possible to bring about change. So I am very impressed with that pyramid, which talks to you about potency, it also talks to you about reputation, it also teaches you at what level of simillimum and what are the possible drug terms. So I think we need to work further on these homeopathic perspectives together so that we can bring about some better conceptual things from Hahnemannian perspective, because those questions are very important when he said about miasm and how miasm moves and what are the miasmatic perspectives. So few of your conceptual slides are really interesting and very impressed with them. So thank you so much for bringing about that part out of that. And I feel the another important input is, and which I always tell to my majority of our mathematics, and please go and study the constituent of the drug. What does it contain? Like, somebody asked me about sepia. What does the sepia contain? If you look at the sepia has calcarea phos, sepia has sulfur. Now you look at the symptomatology, it's a combination of calcarea phos and sulfur. So a lot of calcarea phos patient looks like, sepia patient looks like calcarea phos, and you gradually realize. So the constant like graphite has got ferrum in it. Now all these perspectives gives you much more better insight into mathematics. And that is where you are even, molecular level where you have said, it is very, very interesting that what properties at the molecular level each of those drugs has. We just remain at the level of plant. We don't go into the molecular structure of the plant or molecular structure of the minerals which are the combinations. So that was another lesson which probably has gone to all of us. So thank you so much for this. I really thank you for such a beautiful presentation. Really it was a thought-provoking presentation, probably if you look at from a different perspective. And definitely we can learn a lot of palliative care. It's a teamwork, and probably if we want to take it up, we have to build a team. And then we can work on it, and he is always available to guide us. Thank you so much. Thank you.
A lot of people are listening. One very important question came, I think in spite of all Thanksgiving, it's important to ask. Dr. Saunil Malwalia from Rajkot has asked question. When chemotherapy is to be stopped, when you reside, chemotherapy is also not working. Are we taking part in giving confidence to patient? Can I abhi khali palliative homeopathy pe rahu? That's the question came up. Very vital question.
Absolutely, sir. For me, many times, so there are three most important aspects which come whenever you are treating a patient with that stage. The patient aspect, the relative aspect, which I say the social aspect, and third is the physician aspect. The patient aspect is very important. If the patient says, I don't want to take further chemotherapy, perfectly fine, we stop it, and we will be able to help the patient. Because in one way, what are we trying to achieve? We are trying to get to a patient to the other side of the bank. But if the patient is going to drown in the midway, it doesn't make any sense. But at least through homeopathy, through whatever clinical studies we have, I am sure we can at least take the patient maybe slowly to the banks across. So please tell the patient it's okay. I go with what you say. So just 2 days back, we had a huge fight in my clinic between a husband and wife. So the husband says, but तू chemotherapy ले सकती है. And the wife said, मैं नहीं ले सकती है. Okay? मुझे जलन होता है. उसमें क्या हो गया? He said, उसमें क्या हो गया नहीं. मेरे बाल चले गए. मुझे नहीं होता है. I can't go out. मुझे नहीं लेना. ऐसे कैसी जिंदगी? But लेने से at least you're going to improve. But if it's going to alter your life, and if the patient decides, I said, I'm sorry, I will listen to the patient. If the patient says, मुझे नहीं लेना, period. Everything stops.
Great. So is there any standard form of consent that you use?
Yes. Yes. You want me to show that on screen? Or
You can share with us.
I can share it, yes. It contains everything, including speaking about what is homeopathy. So it's a very structured what we lack in law. Please find, that's why I think ethical body is very important. So that requires to be structured through a lawyer, and then only it can help you medico-legally. Because consent is of course legally, but yes, I have a structured format, I will share it with you. Yes, it's a huge thing which the patient reads and signs.
Sir, during the conference, Tata conference, where we had Dr. Borkar speaking about it, she coined a beautiful term called quality of death. More means in palliative care, it's just not about the way we give them life, but how they are going through the death part also comes under palliative care. And definitely with homeopathic medicines, like how Sir said, those not just few weeks, but 4.8 months also, how they go, how they transit into death, that is also most important. Means dying peacefully is also most important, and that we can achieve with our medicines to some extent.
Absolutely. So thank you so much. So now we can discuss. There is a tea and some refreshment outside. So all of you are requested to help yourself. And I would expect some feedback, at least for us, because we are now entering into palliative oncology.
Feedback and commission. How many of you are committed?
Yeah.
To undertake palliative care training? Then we can ask Ravi to mount a program.
Yes. For us.
Thank you.
Sachin sir.
Yes, sir.
Should we stop? Wait. Stop. नाश्ता केला?